Many doctors would treat their patients differently than they would treat themselves, me included. Shocked? Don't be, because there are reasons. One reason is this: many people wouldn't accept the solutions that doctors take without even thinking. That's true for many treatments, including erectile dysfunction. I'm Dr. Stefan Buntrock, one of the most copied urologists on YouTube. And the reason my copycats will never catch up is simple. I have something fake AI doctors don't have: clinical experience from thousands of real patients. That experience is what sets me apart. If you care about real medicine, not AI copycats, hit subscribe. Let's get into it. So, how does being a real doctor work? When patients come to see me, they usually have something very concrete in mind: a symptom, a prescription, a lab result. At first glance, medicine seems simple. There's a body, there's a problem, and there's a solution. But medicine is not neutral. Medicine is a mirror. And if you look closely, it doesn't just tell us something about the body, it tells us something about the society that shapes it. When men come to me with erectile dysfunction, they are not just bringing a medical issue, they're bringing shame, pressure, expectations, a picture of what a body is supposed to be. That picture doesn't come from the exam room, it comes from the culture outside it, from a world where masculinity is often reduced to performance, where there's little room for night, for touch, for vulnerability, for shame. Doctors rarely talk about this. We act as if it's only about hormones, lab values, and medications. But what we're really treating are bodies that have already started to speak the language of their time. When someone can't sleep, when desire fades, when erections weaken, their body is telling a story, not just their own story, but the story of a culture that values productivity over feeling, control over connection, and performance over resonance. A medical chart is never just a technical document. It's a fragment of a collective narrative. High blood pressure tells of a life that's been accelerated. A testosterone level can reflect expectations that were never met. A fading libido can reveal nights where there was no more room for desire. And all of that ends up on a form, as if it were something objective, stripped of context. But every number carries a story that goes far beyond the body itself. Medicine rarely says what it knows, not because doctors want to keep their patients sick, but because they want to protect them. The truth can be ugly, sometimes unbearable. Some people work very hard to ruin their health. They follow the wrong gurus and spend a lot of money to get there. Telling them their whole life was built on a lie would be unacceptable to them. What doctors tell their patients often reflects what society doesn't want to hear. When we talk about health, we are never just talking about bodies. We are talking about the space those bodies live in, about expectations, about roles, about the things people don't say out loud. If we ignore that, we treat symptoms but change nothing. Medicine can do a lot, but it can't heal what we refuse to name. That's why we need to listen more carefully, not just to organs, but to what speaks through them. I believe medicine can be more than a repair shop. It can build bridges between bodies and stories, between diagnosis and meaning, between statistics and human lives. But medicine always lives within a cultural framework. If Big Pharma is your declared enemy, there is no way I'll convince you to accept a pill, even if it's something I would take without thinking twice. Treatments you've never heard of might scare you. A doctor might say, "When do we start?" And you might say, "Never." A lab value can be a whisper. A symptom can be a metaphor. When we learn to hear that, we change not only our practice, we change the way we see ourselves as a society. Maybe that's the real task of medicine, not just to repair, but to translate, not just to read data, but to hear voices. And sometimes that means stepping back and asking, what is this body actually trying to say about the world it lives in? I'm a urologist. I see men every day, and I see what our time does to their bodies. If we don't name it, medicine remains a bandage. But if we dare to look more closely, medicine can become something much larger, a space of resonance. If that resonates with you, subscribe and stay close. This space isn't just about medicine, it's about what medicine reveals. I'm Dr. Stefan Buntrock, always copied, never matched.